It took me about 15 years to get the diagnosis and treatment for a condition I had since adolescence. I went to over 30 medical providers to get these answers. I would like to preface the rest of this by clarifying that I'm not a medical professional, and none of what I say should be construed as medical advice. I'm simply sharing my experience and highlighting how my diagnosis was continually missed among numerous medical specialties. Also, I'm not trying to disparage medical professionals or particular specialties, but highlight how a lack of knowledge led me, along with many other patients, to a delayed diagnosis. My symptoms emerged shortly after I turned 14. I felt sensations of pressure and fullness around my lower and upper abdomen, which involved the sensation of fluid moving around. This was not simply bloating, though. I knew something was there that didn't feel right. I also experienced pelvic vulvar burning, which I'll talk a little more about later. And so began the saga of seeking medical answers. A few months after my symptoms emerged, I first saw a pediatrician. I didn't get answers, an outcome I'd encounter many more times. Months after that, I ended up getting a bladder ultrasound because one of my symptoms was the feeling that I couldn't completely empty my bladder after urinating. The ultrasound ended up being clear, as would many of the subsequent tests I had, and I got no guidance on what to do next. Fast forward to when I was 18, and I went to a gynecologist. He did not have answers either. He said the fullness, fluid like sensation may be attributed to swollen glands or exploded cysts, and said it would probably resolve itself. I also had a pelvic ultrasound done, and nothing was found. Around this time, I also saw a primary care doctor and gastroenterologist who similarly didn't have answers. Weeks after this, I actually ended up getting appendicitis. I had an abdominal CT and a laparoscopic appendectomy. Interestingly, I was told that the best radiologist had looked at my CT imaging, and this was at one of the best medical institutions in the US. I mentioned the symptoms I'd had for years, but again, there were no answers. I had seen all these doctors and had a surgery, which was getting tiring. I had some hope that maybe my original symptoms of abdominal fullness would also go away, even though I clearly didn't just have appendicitis for the past 4 years. Unfortunately, that would not be the case. Fast forward to a few more years later, I went to see an internal medicine physician. I'd wanted to get more imaging done because I was still experiencing the fullness, even though I wasn't sure what other imaging might show that was apparently missed on the laparoscopy. This internist told me there was nothing that could be done. She also told me to stop going to doctors, although I won't get into that now. It felt like my fears were confirmed, that nothing could be done, even though I knew that something was wrong. A few years after this, when I was 26, I did get an answer, although it wasn't the full picture quite yet. I went to an OBGYN who diagnosed me with pelvic congestion syndrome. He actually performed a transvaginal ultrasound and saw that I had an enlarged left ovarian vein. Finally, I had an explanation for the feelings of fullness that I had, but it felt like there was a missing piece, the upper abdominal fullness that I also had. This OBGYN said that he could do a hysterectomy once I'm older, which had provided relief for other patients of his. There's also ovarian vein embolization, which is a common treatment for pelvic congestion. When I mentioned it to him, he kind of brushed it off, saying if it even works. Since I felt I needed more answers, I went to an interventional radiologist who my physical therapist I had been going to actually referred me to. She did a venogram, which visualizes veins in the abdomen and pelvis, for example. She felt I didn't have pelvic congestion, although she saw that there was some vein dilation around part of the left ovarian vein. She mentioned that there's a condition called nutcracker syndrome that's pretty rare, although she wasn't yet sure if I had that. I had actually read about it once or twice in online forums without really knowing what it was. With this development, I ended up going to, of course, a few more specialists. I went to a vascular surgeon who also did a venogram. He said that my venous anatomy was unusual, as had the interventional radiologist. Also, he said that I don't have nutcracker syndrome, but he saw that there were dilated veins that were presumably causing my symptoms. I was still stumped as to what it could be, so I saw another vascular surgeon. I then got diagnosed with May-Thurner syndrome, which is the compression of the left iliac vein. It's often associated with swelling in the left thigh, although not all patients have that, and that wasn't a symptom I had. It's also a trigger for pelvic congestion with the venous anatomy, and my OBGYN had mentioned I may have this, but never mentioned that stenting is a treatment for it. So I ended up getting a stent placed, and I did notice improvement, but the fullness was not fully gone, particularly the upper abdominal fullness. From there, I saw two more vascular surgeons, and it was the last one I saw who successfully diagnosed me with nutcracker syndrome and performed surgery. Nutcracker syndrome is the compression of the left renal vein between the aorta and superior mesenteric artery. Alternatively, it can get compressed between the aorta and vertebral column. I discussed nutcracker syndrome, which can also trigger pelvic congestion or varicoceles, in further detail in another video. Now, I had gotten conflicting opinions from the vascular surgeons I saw as to whether or not I had nutcracker syndrome. I believe a big reason for this is that I do have an anomaly in my anatomy. It's not incredibly rare, but it's not very common either. My left ovarian vein doesn't drain directly to the left renal vein. So instead of having this significant left ovarian vein, or for male patients, gonadal vein dilation, I essentially had a cluster of what's called collateral veins elsewhere that developed as an alternative pathway in response to the compression. This is what the sensations of fullness and blood pooling were attributed to. Ultimately, the terrific vascular surgeon I saw performed a left renal vein bypass. The left renal vein was repositioned, sitting lower than it was before, in order to avoid it getting compressed. Now it has been roughly 8 months since the surgery. I've noticed gradual improvement. As a whole, I've noticed great improvement in what I'd consider near resolution of my symptoms. I do still feel some lingering fullness and the sensation of blood pooling. Essentially, as my vascular surgeon put it, a reservoir is shutting down. I do have another follow up fairly soon, and I assume there will be a decision as to whether we give it a little more time or do an embolization for those collateral veins. What I described was just a summary of the lengths I went to get a nutcracker syndrome diagnosis and treatment. Most of the physicians and other providers I'd been to, like physical therapists, never mentioned it and likely weren't aware of it. Generally, it's not, as of yet, taught in medical school curriculums or even residency programs. Because nutcracker syndrome and May-Thurner syndrome can cause symptoms similar in nature to conditions like endometriosis or IBS, patients often are misdiagnosed or just undiagnosed when it comes to these pelvic venous disorders. The interventional radiologist I had seen said most patients with pelvic congestion developed it from pregnancy. This certainly didn't apply to me, though. Granted, my case was more unique with my unusual venous anatomy, but the same applies to other patients. There are plenty of patients with pelvic congestion who don't have a history of pregnancy, and male patients can have what's called a varicocele. My vascular surgeon said what causes nutcracker syndrome is lordosis of the lumbar spine, and there is research on this. This is why one of the patient populations is adolescents, including male patients, but especially female patients. During puberty, the female pelvis becomes wider and deeper. To accommodate this shift in gravity, the lumbar spine takes on an anterior curve, and this can have an impact on structures like the left renal vein. In addition, patients with Ehlers-Danlos syndrome comprise a substantial patient population to the impact of weaker connective tissue on blood vessels, for instance. Pelvic congestion can also be associated with pudendal neuralgia due to the pressure that dilated veins have on the nerve, causing symptoms like pelvic burning. And this was the case for me. I believe that a greater recognition of nutcracker syndrome, May-Thurner syndrome, and pelvic congestion among specialists such as OBGYNs, GI doctors, along with primary care doctors, and the suitable tests like venogram and intravascular ultrasound will enable patients to receive needed care sooner.